What is prosthetic artery embolization and when is it needed?
Prosthetic artery embolization is a new novel technique where we use a small microcatheter to access the prostate artery. And then we close these prostatic arteries and the gland shrinks in size over a period of time. And then relieving the patient of his lower urinary tract symptoms like frequent urination, urgency to pass urine, and incontinence, like unable to hold his urine.
Why is prosthetic artery embolization better from conventional modality of management?
Prostate artery embolization is very minimally invasive, hardly have a very small prick that is seen on the skin, very less invasive and very minimal side effects compared to TURP.
What is the experience as you have seen on the patient outcomes with this procedure?
Most of them are very satisfied. Most of them can actually start urinating on their own a few minutes after the procedure. They do not have any problems passing urine. And catheter dependent patients usually don't need to use a catheter by the end of the next day. We usually remove the catheter at the time of discharge and most of them can actually pass urine. The size of the gland, the prostate gland, comes down by at least 30% within the first 1 month after the prostate artery embolization. And their flow rate, I mean, when you pass urine, the speed at which you pass urine also increases tremendously. That increases by about 40% after the procedure. They go back home also, so they're quite happy with this, and there's no bleeding or there's no retrograde ejaculation or there's no dribbling of urine post procedure. So they are very, very comfortable and they can lead a very normal life.
What is the message you would want to give to the general physicians with regards to managing the patients in their own OPDs after this procedure has been done by an interventional radiologist?
Follow up the patient every monthly and every probably after the first 1 month after the procedure, they can get an ultrasound done and a uroflowmetry done to see what the difference is pre-procedure and post-procedure, and then really gauge how the improvement is and follow up with them every monthly or bi-monthly depending on how they are responding to the embolization. And usually the alpha blockers or the other medications are not required post-procedure.